Health News tonight, the first stroke guidelines ever issued by the American Heart Association aimed at women.
News 8's medical reporter Jocelyn Momenton, our New Haven newsroom tonight with more on exactly what this means for women. Jocelyn?
And Darren, a timely story with today National Wear Red Day, raising awareness for heart health in women. A big reason for the guidelines, the overall risk for stroke is higher in women than men, in part because women live longer, but women also have their own unique risk factors. I found out more from a Connecticut doctor who played a leading role in shaping the guidelines.
Developing hypertension during pregnancy, birth control pills, and migraines with aura are more specific and common to women. But what women generally experience in their 20s and 30s are now identified as major risk factors for developing a stroke.
Hypertension, preeclampsia, eclampsia, toxemia doubles the risk of stroke later in life, even if your blood pressure goes back down to normal.
Dr. Louise McCullough at the Stroke Center at Hartford Hospital co-chaired the panel that wrote the stroke guidelines after dissecting masses of data. Screening, she says, is crucial for women more at risk.
So if somebody has a history of preeclampsia and they come see me and their blood pressure is 135, I may bring them in 3 months or 6 months later for a blood pressure check. Whereas if you didn't have preeclampsia or you were 120, I may let you go for an annual physical.
The panel also recommended steps of prevention.
We do know now, and it's in the recommendations, that both calcium supplements and low-dose aspirin in a pregnant woman with hypertension or a history of preeclampsia can reduce the risk.
On birth control pills.
In some women, birth control can actually cause hypertension. So if you're going to put a young woman on birth control, she probably should come back to make sure she's not developing hypertension from the pill.
For women with migraines with aura.
Many gynecologists don't know, to ask, do you have migraine? When you have migraine, do you get spots? Do you get weak on one side? They may not ask that before giving the 25-year-old a prescription for birth control. I think this guideline was like trying to get people to understand the risk and who could be at risk that you haven't identified.
Dr. McCullough says more studies need to be done in stroke treatment and prevention for women. She says 55,000 more women than men suffer a stroke each year, with 60% of the stroke deaths. For more information on the guidelines, log on to WTNH.com.